Welcome to Pharmaceutical and Medicinal Chemistry, Module 4 Central Nervous System Drugs. This module is being divided into 6 chapters. Chapter 4.1 Classification of CNS Drugs, Types and Functions of Non-selective CNS Depressants. 4.2 CNS Stimulants. 4.3 Selective Modifiers of CNS. 4.4 Synthesis and Therapeutic Action of Paracetamol. 4.5 Synthesis and Therapeutic Action of Diazepam. 4.6 Synthesis and Therapeutic Action of Levodopa. Currently, Chapter 4.1 Classification of CNS Drugs, Types and Functions of Non-selective CNS Depressants. Learning Outcomes. At the end of the chapter, you will be able to categorize CNS drugs into non-selective depressants, stimulants and selective modifiers. You will be able to comprehend the role of different categories of general anesthetics, hypnotics and sedatives, opioid analgesics, antipyretic and analgesic drugs, and also you will be able to correlate each type of CNS depressant with its advantage and disadvantage. The contents: Introduction, Functions of CNS, Types of Drug Action on CNS, Non-selective CNS depressants classification, General anesthetics, sedatives and hypnotics, opioid analgesics, antipyretics and analgesics. CNS drugs. Anatomically, the nervous system in higher animals is being divided into central nervous system and peripheral nervous system, consisting of somatic and autonomic nerve fibers. The pink region represents the central nervous system and the yellow region represents the peripheral nervous system. This module, it is completely concerned with the CNS drugs. The major anatomical parts of CNS are the brain, cerebellum, the brain stem and the spinal cord. The fundamental unit of CNS is the neuron or the nerve cell because brain and spinal cord are made up of neurons. Functions of CNS. The CNS is concerned with the regulation of specialized functions such as circulation, digestion and respiration. It is also responsible for the psychic process like feeling, attitude, memory, coordination and control of body posture, perception of pain. Drugs act on the CNS. If there is any malfunctioning on the neuron, it may lead to a disease. So drugs may act directly on the neurons and modify the neuronal functions, or they may act reflexly by sending afferent impulses to the CNS or by affecting the nutrition and oxygen supply, by altering the blood supply or by affecting its metabolism. Types of drug action. Drugs may either stimulate or depress the CNS. Classification of CNS drugs. They are categorized into 3 types: non-selective CNS depressants, non-selective CNS stimulants and selective modifiers of CNS. This chapter is all about non-selective CNS depressants. Non-selective CNS depressants are the drugs which are going to reduce the activity of the CNS. These drugs depress the nervous system and they are going to exert their effect in a non-selective way. Under this, there are 4 types: general anesthetics, hypnotics and sedatives, opioid analgesics, antipyretics and analgesics. General anesthetics. These are the drugs which are going to cause loss of sensation with or without loss of consciousness. Characteristics of an ideal anesthetic. The ideal anesthetic must be inert. It should not cause severe hypotension. It should be non-toxic to brain, liver, heart and kidneys. It should not produce nausea and vomiting. It should be non-flammable. It should provide sufficient muscular relaxation. It should not show any effect on the myocardium. Myocardium is a middle muscular tissue in the heart. And respiration at anesthetic doses. It must be chemically and metabolically stable. It must be sufficiently potent to permit adequate oxygen supply. General anesthetics are further categorized into 2 types: inhalation general anesthetics and intravenous general anesthetics. Formulation general anesthetics. They are volatile liquids and gases. Volatile liquids, the best examples are the diethyl ether and halothane. Structure of diethyl ether. The molecular formula is C2H5O C2H5 and the chemical name is ethoxyethane. Diethyl ether properties: it's a colorless volatile liquid with pungent odor. It is easily miscible in alcohol, chloroform and benzene. The boiling point is 35 degrees Celsius. Advantages of diethyl ether. It is economical, it is an excellent anesthetic, it has a wide margin of safety, it can be used during emergency without any pre-anesthetic medication, it can be administered easily without complicated apparatus. Disadvantages. It is inflammable and explosive. It is an irritant and it may cause nausea and vomiting. It may cause convulsions, fits especially in children. It may rarely cause cardiac arrest. Halothane. The structure of halothane. Molecular formula is C2HBrClF3. The chemical name of this compound is 2-bromo-2-chloro-trifluoro 1,1,1-trifluoroethane. Properties. It's a colorless liquid. It has a fruity odor. It is readily going to attack the metals including stainless steel, brass and copper. It affects the rubber elements of the anesthetic equipment. Advantages. It is non-inflammable and non-irritant to the respiratory tract. It is a potent anesthetic with speedy induction and recovery. The post-operative vomiting is infrequent with this drug. It can induce controlled hypertension. Disadvantages. A special apparatus is required. It's a poor analgesic, slow post-operative recovery, and this drug is going to induce hepatocellular microsomal enzyme, which is rarely going to cause an allergic hepatic necrosis due to the toxic metabolite, and trifluoroacetyl chloride. Gaseous anesthetics: nitrous oxide and cyclopropane. Nitrous oxide. The structure of nitrous oxide. It's a colorless inorganic gas with sweet taste. Advantages: it is non-inflammable and non-irritant. It possesses rapid induction and recovery. The nausea and vomiting are uncommon with nitrous oxide. Disadvantages: the excitement may be violent. CO2 accumulation and hypoxia, low levels of oxygen, may develop during prolonged use. A special apparatus is required to induce this drug. Intravenous general anesthetics. Here we have two categories: ultra short acting barbiturates, thiopental sodium and propofol. Ultra short acting barbiturate thiopental sodium. Here is the structure of thiopental sodium. Molecular formula is C11H17NaO2S. The chemical name is sodium 5-ethyl 5,1-methyl-butyl 2-thiobarbiturate. Properties: it is an yellowish white crystalline solid. It is usually bitter in taste. It is readily soluble in water, and the clinically used solution of sodium thiopental is always alkaline with a pH ranging from 10.5 to 11. Advantages: it is non-explosive and non-irritant. Nausea, vomiting, excitement and post-operative complications are infrequent with this drug. Disadvantages: it causes depression of the respiratory center. It also depresses the myocardium and vasomotor center and produces hypotension. Preparations and doses of thiopental sodium is 0.5 to 1 mg. Propofol. Here is the structure of propofol. The molecular formula is C12H18O. Chemical name is 2,6-diisopropyl phenol. Properties: it is a light straw colored liquid. It is insoluble in water. It is soluble in alcohol and toluene. Advantages: it has no effect on the hypoxic pulmonary vascular reflexes and it is safe during pregnancy. Disadvantages: it has a very narrow therapeutic window. Excess dose can cause greater sedation. Preparation and dosage of propofol ranges from 0.1 mg. The next category is the hypnotics and the sedatives. Sedative is a drug which is going to reduce the excitement, calm the patient. Hypnotics are the drugs which are going to produce the sleep that resemble natural sleep. The characteristic of an ideal hypnotic: it must be rapid in absorption and it must provide rapid sleep induction. It must work all through the night and it should be able to induce the normal sleep pattern. No residual effects must be observed. It must have a specific mechanism of action and it should be safe in overdose. No rebound insomnia should be observed. No dependence, no tolerance, no ataxic effects, no interaction with other drugs or alcohol, no respiratory depression, no memory effects. Classification of hypnotics and sedatives are of three types: selective benzodiazepine agonist, non-selective benzodiazepine agonist, melatonin receptor. Selective benzodiazepine, diazepam. Here is the structure of diazepam. The molecular formula is C16H13Cl N2O. The chemical name is 9-chloro-2-methyl-6-phenyl-2,5-diaza-bicyclo-I-4-0-undeca-5-8-10-12-tetraene-3-one. Properties: it is slightly yellowish crystalline powder. It has no odor. It is very slightly soluble in water, sparingly soluble in propylene glycol and soluble in ethanol. Advantages of this drug: it can induce sleep even in the presence of pain and it does not cause hyperalgesia, more pain. Disadvantages: it causes drowsiness, lethargy. Lethargy means lack of energy, and ataxia, it's lack of coordination. And it rarely causes vertigo, headache and leukopenia. Dosage of diazepam ranges from 5 to 10 mg. Non-selective benzodiazepines, zopiclone, the structure of zopiclone. The molecular formula is C17H17Cl-N6O3. The chemical name is RS6-5-chloro-2-pyridyl-6,7-dihydro-7-oxo-5-H-pyrrolo-3,4-pyrazine-5-allyl-4-methyl 1-piperazine carboxylate. The properties: it's a colorless solid. It has no odor. The characteristics is it is going to induce sleep and it is rapid in onset and have short duration of action. It has an adverse effect on memory and cognitive function. The dosage of zopiclone is 5 to 10 milligrams. Melatonin molecular formula is C13H16N2O2 and here is the structure of melatonin. The chemical name is N2,5-methoxy-1-H-indole-3-allyl-ethyl-acetamide. The characteristics is it is going to prevent the jet lag. It's going to induce post-travel sleep. The disadvantages of this drug is it's going to cause the drowsiness, insomnia, frequent awakening, anxiety, headache and irritability. Dosage: melatonin ranges from 0.5 to 5 mg. The next category we have is the opioid analgesic. The word opiate is being derived from the products that are being produced from the opium poppy. The word opioid is being used for the natural, synthetic and semi-synthetic drugs which are going to relieve from pain and depression. These are being classified into three types. Agonist, pethidine, partial agonist, buprenorphine is the example. Mixed agonist, antagonist, pentazocine is the example. Agonist pethidine. The structure of pethidine. The molecular formula is C15H21NO2. The chemical name is ethyl 1-methyl 4-phenyl piperidine 4-carboxylate. Properties: it's a white crystalline solid. It is bitter in taste. It is freely soluble in water. Advantages: it's going to provide relief from moderate to severe pains and it produces mild euphoria. Euphoria means excitement and happiness. Disadvantages: it causes nausea and vomiting. It's going to produce hypotension and tachycardia, rapid heartbeat, it may be regular or irregular, dryness of the mouth, dizziness and visual disturbance. Dosage of pethidine: it is available in the form of the tablet and injection. Pethidine hydrochloride tablet 25 to 100 mg, pethidine hydrochloride injection 50 mg per ml. Partial agonist buprenorphine. The structure of buprenorphine. The molecular formula is C29H41NO4. The chemical name is 7,8-dihydromorphine 6-O-methyl ether. Properties: it's a white crystalline powder, slightly soluble in water. Advantages: it is going to provide relief of moderate to severe pains and less respiratory depression. It is more potent and possesses longer duration of action. Disadvantages: it causes drowsiness, nausea and vomiting, constipation, meiosis and hypotension. Preparations and doses: buprenorphine tablet 0.2 mg and buprenorphine injection 0.3 mg per ml. Mixed agonist. Antagonist, pentazocine. The structure of pentazocine. The molecular formula is C19H27NO. Chemical name is 1,2,3,4,5,6 hexahydro-6 11-dimethyl 3,3-methyl 2-butanol 2-6-methano-3-benzosine 8-ol. Properties: it's a white crystalline powder. It is slightly bitter in taste. It has no odor. It is very slightly soluble in water. It is resistant to heat, light and air. The advantages is it do not cause euphoria. Constipation is uncommon with this drug and it is going to cause less respiratory depression. Low dependence liability. Disadvantages: it causes sweating, dizziness, nausea, hallucination and unplain dreams. The dosage: pentazocine tablet 25 mg, pentazocine injection 20 mg per milliliter. Antipyretics and analgesics. Antipyretics are the drugs which are going to restore the normal body temperature at the time of fever. Analgesics are the drugs which are going to give relief from pain. There are of four types. Salicylates, aspirin is the example. Para-aminophenol derivatives, paracetamol. Indoles, indomethacin. Propanoic acid derivatives, ibuprofen. Salicylate, aspirin. The structure of aspirin. The molecular formula is C9H8O4. The chemical name is acetyl salicylic acid. Advantages: it is going to produce relief from pain without hypnosis or impairment of mental activity. It is used for toothache, headache and backache. Disadvantages is it causes skin rash, dyspepsia, indigestion, nausea and vomiting. The dosage of aspirin is 300 mg. Para-aminophenol derivative paracetamol. The structure of paracetamol. The molecular formula is C8H9NO2. The chemical name is N4-hydroxyphenylacetamide. Properties. It's a white crystalline powder. It is insoluble in water. Advantages. It is a potent antipyretic. Lack of sedation, lack of respiratory depression, and it is cheap and safe. Disadvantages. Large doses of paracetamol cause hepatocellular damage and renal tubular necrosis. Preparations and dosage of paracetamol is 500 mg. Indoles, indomethacin. The structure of indomethacin. The molecular formula is C19H16Cl NO4. The chemical name is 1-parachlorobenzoyl 25-methoxy 2-methyl-indole 3-ester acid. Properties. It is an yellow crystalline powder. It has no odor. It is slightly bitter in taste. It is insoluble in water. Advantages. It gives us quick relief of pain and reduction in the joint swellings. Disadvantages. It causes headache, giddiness, mental confusion, blurring of vision and depression. Preparations and dosage of indomethacin is 25 mg. Propanoic acid derivatives ibuprofen. The structure of ibuprofen. Molecular formula is C13H18O2. The chemical name is RS242-methylpropylphenylpropanoic acid. Properties. It is a colorless crystalline solid. It is readily soluble in organic solvent but least soluble in water. It has characteristic odor. Advantages. It is cost effective. It is going to relieve from pain, reduce the redness and swelling. Disadvantages. It causes gastrointestinal disturbance such as epigastric pain, nausea, sensation of fullness in the stomach and heartburn. It also causes headache, dizziness, blurred vision. It rarely causes impairment in renal function. Dosage of ibuprofen is from 200 mg to 400 mg. So students, what all we have learnt? In a nutshell, we have learnt about the composition and functions of the CNS, types of CNS drugs, role of different classes of CNS stimulants along with the uses, properties, advantages, disadvantages, dosage forms of different types of general anesthetics, hypnotics and sedatives, opioid analgesics, antipyretic and analgesic drugs. Thank you.